An eating disorder is very, very lonely. But treating means getting help, and sometimes a variety of treatment options are combined. Some doctors combine traditional therapy with holistic methods.
All right, deep breath in and out. I use acupuncture for some of my clients who are really having a tough time managing impulse control disorders like binge eating disorder.
How you doing? I'm fine. I've blended with the chair.
It really helps to get the whole neurochemistry sort of settled down so that a person is more receptive to the counseling process and they're a little more in touch with what's going on in their environment. And that is how we alleviate pain. We can alleviate emotional disorders as well.
Dr. Andrea Pennington is the president of the Pennington Institute for Health and Wellness in Silver Spring, Maryland, which specializes in obesity treatment and eating disorders. And Kathleen is with us here. I have to ask you, does that hurt when Dr. Pennington does that?
It's just a little prick that goes in, so it isn't really that painful.
Explain the variety of treatments that you are getting simultaneous to having acupuncture treatments for your binge eating disorder.
We have a group meeting once a week. This is part of the whole program. And I also have individual therapy every other week. And I'm supporting that with antidepressants also.
So that's quite a package of, why do you have to attack it from so many different?
Well, what we find with people with binge eating disorder and really all of the eating disorders is it's a multifactorial problem. Whether we can determine if there was a specific event in a person's past that led them on this tirade, the truth is, once they become an adult, they've found different ways to cope. And one of the ways to cope with some of that trauma or that pain or shame is to bury it. Some people bury it with food, others with substances, alcohol, and what have you. And so it really takes a multidisciplinary approach to get at that root, while at the same time giving them relief for this intense traumatic experience that they're reliving almost on a daily basis.
The role that those needles played in the ear, Kathleen's ear, to interrupt the cycle of addiction. How does acupuncture interrupt the cycle?
It's pretty incredible. We've been using ear acupuncture for addiction in this country for decades now. And what we know is that with placing these tiny pre-sterilized needles, we're able to affect their neurochemistry. So what we're able to do is to bring the body a sense of calm by raising certain endorphins like dopamine, like serotonin. So rather than having to lean on a substance like an alcohol or food, we're able to help bring up the mood, calm the body. And it alone cannot work. Acupuncture is not a cure for addictive problems. We can use it to detox and to control some of these impulse control behaviors, but then they have to be in a therapeutic relationship.
I want to show one other thing you do before we show it. Would you explain what the somatic experience is for?
Somatic experiencing gives us another way to get into a person's trauma or buried pain, because what we tend to do as human beings when we're faced with some threat or some incredibly overwhelming, painful experience is many times we do suppress, suppress, suppress. And when you suppress that pain or that energy, it can later manifest itself in mental disease, in insomnia, anxiety, intestinal problems. And then for many people, they need to act out to get rid of that energy.
Well, we're going to watch Kathleen undergo her first session with this somatic experience at Dr. Pennington's Institute.
What does happy feel like in your body? Relaxed. I'd like you to go back and recall, if you can, what was happening before the craving started? I just jump right to the food. When you're experiencing a cycle like binge eating disorder, there's a physiological cycle that your body goes through in conjunction with that. And what I'm trying to do is help her move out of that cycle. So you're just starting a new process of tuning in. And what do you notice? I feel like I'm relaxing more.
How did it make you feel in the long run?
Well, that was the first time that I had done that, and something that I would try again. It was hard to kind of get the gist of it, you know, to going back and forth and trying to find my traumatic experience.
Dr. Pennington, why do you say that that somatic experience, which seemed fairly innocuous as Kathleen experienced it, is sometimes so intense you have to back off?
It is really intense because as we start to get people back into their body, and I think as your guest pointed out earlier, sometimes we can shift energy and really dissociate from our bodies where we don't feel. So as we guide a person back into feeling what they feel like just before a binge, it can be very, very intense. And if they're not quite prepared to deal with it, we will back off.
Up next, one binge eater learns how to select the right treatment to get back her life.